Next, I'm going to talk about pain. So pain is a general sense, okay? And it is an important one because it comes up quite a bit in the clinical setting. So first of all, why does pain even exist? Well, pain exists because it's protective. When you have pain, you're more careful with the injured structure, and it allows it time to heal. And pain lets you know when something is wrong so you can do something to fix it or prevent it from happening again. To give you a good example of how important pain is, let's look at the condition called diabetic neuropathy. So this is something that can happen in individuals with ill-managed diabetes. So what happens in cases where diabetes isn't managed properly is that the high blood glucose levels cause damage to the walls of blood vessels. And some of these blood vessels are feeding blood to the nerves in the feet. And if the blood vessels to the nerves become damaged, then the nerves themselves become damaged and can no longer conduct signals. So basically, these individuals can no longer feel what's happening in their feet. And so if this person gets an injury to their foot, they may not feel the pain. And if they don't feel the pain, they may not take proper care of the injured foot. And they can develop a severe infection that can lead to amputation. So this is why there's a large number of amputations that occur in diabetic populations. So pain is important. The type of cell that can detect pain is called a nociceptor. Noci means pain in Latin. So these are neurons that detect excessive stimuli of any kind. So they can detect excessive movement, excessive chemicals, excessive heat, excessive cold, right? They respond to excessive stimuli of any kind. And like other neurons, these nociceptors experience an action potential when they are stimulated. And the nociceptors can also become more sensitive to pain through a process called sensitization. So I'm going to talk about that right now, this process of sensitization. So this is the process of a pain detecting cell becoming even better at detecting pain, which sounds bad, but again, it's protective, right? So sensitization is really a process that makes it easier for these nociceptors, these pain cells, to release neurotransmitter. And various chemicals cause the process of sensitization. When you hurt yourself, like if you cut yourself or get a burn, the damaged cells produce local chemical messengers called prostaglandins. So in the picture here, we can see our very sad damaged cell, and it is producing these chemicals called prostaglandins. And the name of the enzyme that helps this process along is called the COX enzyme. Now, prostaglandins and other compounds that are released by the damaged cells are important signals for starting the healing process. One of the things that they're going to do is recruit white blood cells to the area, and these white blood cells can then look for pathogens and things like that. But the prostaglandins also cause pain sensitization. The prostaglandins bind to receptors on the pain cell, on the nociceptor, and once the prostaglandin binds to the receptor, this causes an increased sensitivity to pain in that nociceptor. And it makes it much easier for this nociceptor to produce an action potential. And now, what used to be a non-painful stimulus becomes painful. If you think about this, you've experienced this before. Maybe you've gotten a bad scrape on your knee, right? Now, normally when you touch your knee very lightly, it doesn't hurt. But if you have a horrible scrape on your knee and you touch that, it is painful, right? So that's a non-painful stimulus, light touch, that has now become painful. And that's what happens through the process of sensitization. So now that we know pain is important and we know how sensitization occurs, let's look at how we can stop pain, right? Because we don't always want pain or don't always need pain, right? Analgesics are pain relievers. Some analgesics are endogenous, meaning you make them in your own body. So you do make your own pain relievers. Maybe you've heard of serotonin or enkephalins or endorphins. All of these things are your natural pain relievers. Maybe you've heard that when you exercise, you release endorphins. And endorphins reduce the intensity of pain that's sensed by the brain during exercise, allowing you to continue the activity. Some analgesics are exogenous, meaning they're not made in your body. So opioids such as morphine, codeine, and heroin are exogenous analgesics. NSAIDs, which are non-steroidal anti-inflammatory drugs, are also exogenous, and acetaminophen is exogenous. What's kind of interesting is all of the research that's been going on with pain. Studies have shown that in most cases, 30% of people who receive a pain pill placebo, so in other words, they're receiving a dummy treatment that's not supposed to reduce pain, they report pain relief. So this is someone that's getting like a sugar pill and saying, yeah, it's helping with my pain. Sometimes, in certain studies, this can be as high as 75% of individuals in the study report that the placebo helped relieve pain. So really what this is telling us is that there's a lot of remarkable things happening at the level of the brain when it comes to pain perception. And we need to do a lot more research on this because some analgesics are dangerous and we try to avoid using them unless necessary. And that kind of leads us to these exogenous opioids, which can be very addicting. They can be very, very beneficial to individuals who need them, though, too. So opioids are a very hot topic right now. One of the reasons being major problems with addiction, but also there's been a huge rise in HIV infections in the United States. And this is due to needle sharing from addicts that shoot opioids, right? So, and I'm not just talking about heroin here. There are many different opioids that addicts will inject, and that leads to the needle sharing. Exogenous opioids include heroin, hydrocodone, which you might also know as Vicodin, oxycodone, morphine, codeine, methadone, fentanyl, and then there's many more. When they're used properly, like I said, they can be very, very beneficial to people with intense acute pain. And how opioids work is they alter pain signaling pathways, effectively blocking pain signaling. But they should not be used long term because they're addicting. Opioids are very addicting because they can lead to physical changes in brain neurons, and that leads to the altering of pleasure signaling in the brain. And whenever someone is using a substance that can alter pleasure signaling in the brain, that can lead to a very addicting state. Now let's take a look at some of the pain relievers that are less addicting, like NSAIDs. So NSAIDs are non-steroidal anti-inflammatory drugs. And what this means is they're not steroids, like cortisol, and they are anti-inflammatory in nature, meaning they reduce inflammation. They include what's commonly known as ibuprofen, aspirin, and naproxen. For those of you that aren't familiar with naproxen, that's what we think of as Aleve. These do not alter pleasure signaling in the brain, so they are less addicting. Anything can be addicting. However, if a substance doesn't alter the pleasure signaling in the brain, the level of addiction is highly reduced. The NSAIDs work by inhibiting those COX enzymes that I mentioned. If you remember back to when I was talking about sensitization, the prostaglandins were the chemicals that caused the nociceptors to become more sensitive. The NSAIDs work by inhibiting the COX enzyme, and if they inhibit the COX enzyme, then the damaged cells no longer produce prostaglandins, and without the prostaglandins, we get less pain sensitization. So NSAIDs do not stop pain signaling. They just reduce pain by reducing sensitization. So if you've ever had severe pain and tried something like ibuprofen, you've probably noticed it does not make the pain go away. It maybe can take the edge off a little bit, but it doesn't make it go away. What about acetaminophen, though? So acetaminophen is not considered an NSAID. The reason being it is not anti-inflammatory in nature. Okay? Like the NSAIDs, acetaminophen also inhibits COX enzymes, but it does it a little differently. The NSAIDs, like ibuprofen, they work at the level of where the damage is. So we call it a peripheral actor. So they'll work like, if you got a cut on your knee, ibuprofen is going to reduce sensitization right at the knee. Whereas acetaminophen will reduce sensitization, but at the level of the central nervous system, not at the peripheral level. So acetaminophen does not work on peripheral tissues like the NSAIDs do. It works at the level of the brain, inhibiting COX through a different pathway. The central brain COX inhibition pathway seen with acetaminophen does not reduce inflammation. If you think about it, that makes sense. Inflammation occurs right where the damage is, like at the knee, if you bump your knee, right? And since acetaminophen does not work at the peripheral tissue level, it works at the central level, it doesn't reduce inflammation. And even though acetaminophen affects the brain, it does not alter pleasure signaling in the brain, so it is not addicting like opioids are. So this little graphic just kind of explains the different pain pathways and where these different drugs work at. So like NSAIDs work at the site of injury. NSAIDs also work at the level of the spinal cord too. Opioids can work at the level of the spinal cord, but they also work at the level of the brain. And acetaminophen only works at the level of the brain. Now, don't forget, even though both acetaminophen and opioids work at the brain level, acetaminophen is not addicting because what it's doing at the brain is not altering pleasure signaling.